Hello, everyone, and welcome to Cassie and Friends Ask the Expert session. I am so pleased to welcome everyone here today to sit in on a really special conversation. Last month, Cassie and Friends launched a youth mental health strategy in response to growing concerns about youth mental health across Canada and the world, but also specifically in response to what we've known and heard from youth and families for many years working in the pediatric rheumatic disease community. And that is that they feel underprepared and undersupported to deal with the many emotions and mental health impacts of childhood rheumatic disease. Cassie and Friends strategy included three major pieces. We launched a new research partnership with Brain Canada to offer $480,000 in new funding to youth mental health, specifically focused on pediatric rheumatology, grants that importantly put cross-Canada collaboration at their center. We also launched a brand new youth mentorship program online to ensure youth have easy access to trained peer mentors who also live with rheumatic disease. Finally, we formed or are forming a national working group for pediatric rheumatology mental health, where we will bring together experts from across Canada, which includes patients and family members at the table, to take stock of what the current state of youth mental health in childhood rheumatic disease care is today, and what we can do together to make immediate improvements in the wake of what is being called nationwide a crisis in youth mental health. We really hope our discussion today will highlight the need for better mental health screening protocols and services in pediatric rheumatology clinics, and to begin a much more open and collaborative discussion between youth, their families, and healthcare teams about the many impacts of rheumatic disease in children that go far beyond the physical. And one of our motivations for this entire youth mental health strategy are truly words of a youth in our community who said, "You can't see it, but I'm in pain." And that is in the spirit of which we are all trying to better see the many kinds of pain that juvenile arthritis and other childhood rheumatic diseases can bring. And with that, I'm very, very pleased and honored to introduce our panel today. First, we have Kayla Mozill. Kayla was diagnosed with juvenile arthritis at the age of 16 while living in Calgary. She went on to study at Dalhousie, where she competes nationally in synchronized swimming. Over the years, Kayla has been a constant friend at Cassie and Friends, and she's been an incredible leader. Most recently, she was accepted into our 2023-2024 cohort of the Cassie and Friends Youth Future Leaders Program. And her work now will include ways to raise more awareness about juvenile arthritis and other rheumatic diseases in our community. Welcome, Kayla.
Hello, thank you for having me.
And next up, I'd like to introduce Dr. Andrea Knight. Dr. Knight is a clinician investigator in the Division of Rheumatology and associate scientist in neuroscience and mental health program at the Hospital for Sick Children, or SickKids, in Toronto. She also serves as the Canada Research Chair in Mental Health and Chronic Disease of Childhood. And she has been very, very involved in developing both our research program for youth mental health and the Youth Mental Health Working Group with Canada, or with Cassie and Friends. Her clinical research program focuses on childhood onset lupus and mental health for youth with rheumatologic conditions. And she's also investigating the impact of inflammatory diseases such as lupus on brain structure, function, and development. Welcome, Dr. Knight.
Thank you. Pleasure to be here.
And now I would like to introduce Dr. Elizabeth Stringer. So Dr. Stringer is an associate professor of pediatrics at Dalhousie University and a pediatric rheumatologist at IWK Health Center in Halifax. Her research and clinical passions include studying and caring for children with juvenile idiopathic arthritis, the transition of youth from pediatric to adult healthcare, and also pediatric Lyme arthritis. She has recently assumed the chair of position of the Canadian Alliance of Pediatric Rheumatology Investigators, a body that some might know as CAPRI. And she is also a medical advisor for Take a Pain Check, which is a nonprofit organization in Canada committed to the mission and vision of supporting youth and young adults with rheumatic disease. Welcome, Dr. Stringer.
Thank you, Jennifer.
And finally, I am very, very pleased to introduce Dr. Ashley Danguecan. She is a pediatric clinical neuropsychologist. And during her residency and neuropsychology postdoctoral training at the Hospital for Sick Children, she gained a very large understanding of the assessment, treatment, and research experience with a range of complex medical diseases in children, including children with neonatal brain injury, genetic and metabolic conditions, epilepsy, brain tumor, leukemia, and sickle cell disease. Since 2018, Dr. Danguecan has been a staff neuropsychologist at SickKids, where she works closely with the Division of Rheumatology. She also leads a mental health screening program and conducts very important mental health and cognitive outcome research. Welcome.
Thank you very much. I'm very happy to be here and look forward to our conversation today.
Amazing. Okay, so we are going to jump right in, and you might even just want to turn your sound on if you don't have any background noise, because you just never know when you're going to need to speak. And I know sometimes we start speaking and forget to turn the mute off. So I was actually going to start with Dr. Stringer, because Dr. Stringer recently was part of a team that published a very important study. The study was titled "High Rates of Symptoms of Major Depressive Disorder and Panic Disorder in a Canadian Sample of Adolescents with Juvenile Idiopathic Arthritis." And Dr. Stringer, I just wanted to invite you to tell us a little bit more about your research study and what you found.
Sure. Thank you. So as Jennifer said, we conducted a research study in our clinic. And this really arose from the fact that in our clinical experience, we were finding that there was a high burden of mental health challenges in our patient population. And we really wanted to actually have a better understanding of what that looked like. And so this was actually before the pandemic. So in 2019, we and my team conducted a study in which we basically asked adolescents between 12 and 18 years of age who are coming to clinic anyhow to fill out a screening questionnaire about their mental health. And then we also asked them some questions about how they were doing in relation to their arthritis that day, and asked the doctors also to provide a little bit of information. And so the questionnaire that we had them fill out, we actually just did on an iPad in the waiting room or privately, depending on the adolescent's preference. And basically these questions, when you put them all together, were designed to basically assess whether a person is at risk of having specific types of anxiety disorders or depression. And so there's actually 6 different types of disorders that we were looking for. And the majority of them were anxiety type disorders. So there's a condition called separation anxiety disorder, social phobia, generalized anxiety, panic disorder, obsessive compulsive disorder, and then lastly, major depressive disorder. And so when we calculated the scores for each of our participants, we could assess whether they were at high risk of having one of these corresponding conditions. And so basically we asked every adolescent that came to our clinic to fill this out. And we had 82 patients that we approached over a 3-month period. And we actually had 80 adolescents fill out this questionnaire. So almost 100%. So that gives us a good snapshot of our clinic. And what we found out was that 40%, or on average 4 out of 10 of our patients, actually scored above the threshold for one of these conditions, suggesting that in our clinic population, just patients that were coming in on a regular basis actually very well might likely have a mental health disorder, which is something we actually thought might be the case, but it was a little bit higher actually than we expected. And so what we also found was interesting, that of those 6 disorders, the 2 highest were major depressive disorder and also panic disorder. So about 25% of our patients reported symptoms consistent with major depression, and about the same reported symptoms consistent with panic disorder. And to our knowledge, panic disorder has not been assessed as a specific disorder in many of the studies that have been done before, and we found this really, really interesting. When we looked to see who was potentially more at risk for reporting a mental health condition, we did find that females more than males reported a mental health disorder or symptoms suggestive of that. We also found that individuals who actually reported their disease activity as higher on the day of the visit were more likely to report symptoms suggestive of a mental health disorder, which we thought was also really interesting. And so we took out of this that unfortunately we confirmed that there is a high burden of mental health challenges in our patient population. And what I took out of this and our team took out of this was that screening is really important, and this is for a number of reasons. We know, at least where I practice, that a lot of people don't have family doctors. We also know from previous research that patients actually feel the most comfortable disclosing some of this information to their rheumatologist because they have an ongoing relationship. So I do think we need to be the ones to help find these individuals who are struggling. And then, of course, we need appropriate access to mental health care. And I think really important is the shared care. So even though sometimes we're able to find a psychiatrist or a psychologist, I really find that on a practical basis, we don't overlap in our care. And I think that's really, really important. And I think that is better care for the patient. And we also, as healthcare providers, learn more about the mental health side of things, and the mental health providers learn more about the rheumatologic side of things, which I think is really critical. So, as I guess disheartening as it is that we found this information, I think at the same time, I think it's wonderful that Cassie and Friends is starting this initiative, and there's some great mental health researchers in Canada who we're going to hear from next to really, I guess, get to the root of this problem and how we can help our patients in the best way possible. And I'll leave it at that.
Amazing. Thank you, Dr. Stringer. It sounds like that's, a really important sort of look at what might be going on in Canada with, and it sounds like there's not really another comparable sort of just Canadian center snapshot study to help us start looking at what youth with pediatric rheumatic diseases might be experiencing. Also, it sounds like that's an incredibly high response rate for a research study, like up in the almost 100 percentile. And I wonder just if you could tell us a little bit about why you think you had such a great response from patients and their families, and maybe even what that conversation looked like when you were approaching people to participate.
Yeah, so we were surprised as well, but obviously very happy with that response rate. We actually sent a letter. We kind of had a list of patients who were coming, and we sent a letter to them ahead of time. And we actually kind of talked about, why we were doing this research and why we thought it was important. We did give families the option to call ahead and say, we're not interested in participating, just so that they could sort of opt out. And then basically, I don't think we heard from anybody. And so when they were waiting in the clinic, we just had our research coordinator come up and say, we sent you this letter. Are you still interested? It really probably only took them about 5 minutes, and here's an iPad, and, fill out this questionnaire. And so I think, having families understand the reason why we're doing the study, and also the fact that it was a very quick study and just a one point in time, I think that also helped. And we do hear from families all the time that this is such an important issue. So I think that really maybe spoke to the parents and the adolescents themselves. So that, I think, all contributed to how we had such a good response rate.
Well, I think that's awesome. I think that it sounds like so inclusive of what like the patients and parents might also want, and like to send that sort of advance notice of, is this okay to bring up in your clinic appointment? And to sort of give them that option to opt out before they come. I think just kind of highlights that it is a sensitive topic, and there needs to be sensitivity around it. And we're so glad that so many people participated, and thank you to everyone, if you're watching from IWK, who did participate, because that's really helped us to have this conversation today and to start looking deeper into these issues and how we can help. I wanted to turn over to you, Kayla. Obviously, you are, I think, the truest expert on this panel, in that this is something that you live with and have to navigate every day, with juvenile idiopathic arthritis being a part of your life. And I wondered if you would just give us like a little bit of an introduction to your story. And also, just share a little bit about what some of the mental health impacts of having juvenile arthritis has been in your life.
Yeah, you already kind of mentioned I grew up in Calgary, and I was diagnosed with arthritis when I was in high school. And I think that was really difficult just because it's already hard to be different, especially in high school when you're, I don't know, personally, I was just trying to fit in, go with the flow, and trying to like push through certain things sometimes. That I think did take like a big toll on my mental health, like just trying to like keep up with the speed of the hallways and like small things that you don't really think of, but it was hard for me to like walk and keep up with people or hold my pencil as long as everyone else could, like writing essays and stuff. And when I was first diagnosed, I think it was just hard to explain to others what I was even going through, because I still didn't even fully understand it. When you're first diagnosed, you get so much like information overload thrown at you, and you do have the tools to figure out what's going on, but it takes time to, like, you're thrown into all these new meds. I didn't even know what arthritis was when they told me I had it. So figuring it out and then explaining it to others is a whole nother step. So I think that was something that I did really struggle with when I was first diagnosed, but then moving into like adulthood a bit more, I just realized that it is okay not to be okay. And you do need to tell people and advocate for yourself when you are having those days so that they know. But yeah.
Absolutely. Thank you. And I understand that was sort of one of your clues that led you to being diagnosed. And I heard this on your amazing episode interview on Take a Pain Check, which I encourage anyone watching to listen to Kayla's podcast there. You can Google her name and take a pain check. But that it was actually another peer who also lives with juvenile arthritis who recognized your symptoms.
Yeah, we were doing CrossFit together actually at the time, and it was just super random because she was feeling my fingers one day and was like, I think you have arthritis. I was like, no way. I don't know what this is, but it's definitely not that. And then, my chiropractor was actually the one that referred me to the doctor.
What did the role of kind of just having that sort of peer connection and support play in you coming to understand what was going on with you, and in what ways did that sort of peer support, like either did you lean on it? Was it an important support?
Yeah, it was definitely a huge support. Kind of like I said, you just feel very isolated and like no one really understands what you're going through. And it was hard for me to explain to my friends, my parents, teachers, coaches. Like there were a lot of people who would get it, but you never know like who was going to understand and who was going to be very just kind of like, oh, well, that's not a real thing or whatever. So having that one friend who'd been through all this, she was diagnosed at a lot more of like a younger age. So she like had a lot more knowledge, and it was so good for me to be able to ask her like questions, and we kind of would bounce back and forth like, oh, have you taken this medication, or how did it make you feel? Is this like a normal symptom? And even like my hair was thinning at one point, and I was like, what shampoo do you use? And like just like for little things, sometimes it was so nice to be able to just talk about it freely. So that was like a huge thing. And I think that like for anyone, if you can like find someone that you can just talk to and understands, it makes a huge difference.
And just thinking back to some of the data that came out of Dr. Stringer's study, what parts did you relate to? And like specifically, and Dr. Stringer, correct me, but it was that piece of the correlation between, or how you're feeling might be related to how your disease is acting.
Yeah, I think that is like how I've always felt with it. I don't know, personally, like if I'm going through a flare up, I find that my mental health that day is definitely not as good. Like I don't want to leave the house, and then that honestly just makes everything worse. So it's like when I have those days, it's like, okay, get up and at least go on a walk. Like getting outside, I don't know, just makes like all the difference for me. And I guess even like on the like anxiety aspect, like for me, I still do sometimes find it so stressful to like tell people, oh, I have arthritis, like new employers or like teachers or things, just to be like, this is like a real thing. Like sometimes I need to work from home or I'm going to go on a walk. So I think it's so good that this research is coming out, being done, and it just like, yeah, teaches more people about it.
And Dr. Stringer, actually, I wanted to ask, you didn't mention it, but what, when you questioned also the doctor or the physician that was treating the patient about how they felt their mental health was doing, what did you find with that piece? Like, did it match the kids?
We didn't actually ask the physicians. The survey that we did was actually anonymous, so that and we did that partially to encourage people to be honest about how they were feeling. After the survey, as a safety measure, we did once, because we did it before they saw the doctor. So we did afterwards say, you know, we know you just did this survey. How did it make you feel? And we sort of followed up to make sure that we hadn't sort of triggered any, you know, significant feelings, but we didn't collect that information. So I don't have a correlation there. I was surprised at like 25% reporting symptoms consistent with major depressive disorder. I don't think I get that sort of just in my routine questioning. And also, I think, as we talked about a bit earlier, the panic disorder piece was sort of really interesting. And I did have I have a psychiatrist and a psychologist who worked with me on this study, and they did wonder whether, because with panic disorder, it's often you start to feel physical symptoms as sort of a consequence of, I guess, a mental health disorder. And for a person with arthritis, they're very used to experiencing physical symptoms because that's sort of the nature of the condition. And whether that somehow relates to why people may feel these physical symptoms and signs of stress. I mean, it's very much trying to understand that, but I thought that actually did kind of make some sense to me.
And how have you felt, Kayla, speaking with your healthcare providers about, I guess, sort of all of the ways that you might be struggling with juvenile idiopathic arthritis?
Mm-hmm. I don't think I've really utilized them as much as I should have, because I know that they do have people that you can talk to for mental health, or like the physiotherapist people, and then along with the rheumatologist, I normally am quite in and out. Like I just want to see my rheumatologist and like get out of there. I think that, yeah, like I definitely should have utilized them more. It's hard sometimes when you are in clinic and you've already been waiting for 2 hours, and then they're like, oh, how do you feel? And I'm like, I feel kind of terrible because I've been waiting here forever. But yeah, that just like kind of opens a whole can of worms. And yeah, I think I definitely should have used them more. But I think just like sometimes when I am in clinic, I do feel fine. Like mentally, it's like I'm having a great day. And then it's more on like those bad days when like they're not around. And I think that like Cassie and Friends is a great way to like reach out to other people and have kind of that support system. But yeah.
Thank you. Thank you. Well, I think that was actually an excellent springboard to bring Dr. Knight into the conversation. Dr. Knight, you practice at the Hospital for Sick Children as a pediatric rheumatologist. And I think what Kayla just said about sort of, I know there's some other supports and there's resources for me, but you know, maybe there's not always an understanding of what they can provide. But from your perspective, like what supports currently do exist within the pediatric rheumatology teams for youth and families that feel they need some more support?
So thanks for the question, and thanks, Kayla and Dr. Stringer, for all your comments so far. So I think that it's variable across the country in terms of what's available at a particular, rheumatology clinic. Sometimes it's a social worker who can help to talk about emotions and provide a little bit of counseling and guidance about emotions. Sometimes a psychologist might be available to provide like psychotherapy or talk therapy or other more specialized types of therapy. Sometimes a psychiatrist is available to do those things I mentioned, but also think about any medications that might be needed. Other places might have adolescent medicine available. So these are doctors who specialize in the care of adolescent age patients, and they can help with mental health problems, as well as a whole array of adolescent issues, health issues that come up. Other places might utilize child life therapists as well for various things, particularly the younger age groups of our patient populations. But the thing is, not all of these wonderful resources are available at every clinic as much as we would really love them to be. So it's a little bit piecemeal, like leveraging sort of what is available at the different sites. And sometimes, most likely the physicians and the clinical team know what's available, but not always. Sometimes it takes a little bit of digging to figure out, well, what is available to our patients and to meet the mental health needs for our patients. Because really, I think that, pediatric rheumatology community as a whole, in terms of thinking about the mental health aspect of care, it's a relatively newer thing, like I think 10 years ago I don't think that this was really talked about or really at the forefront. And I think that over the past, I would say 8 to 10 years, particularly maybe in the last 5 years, and certainly with the pandemic and the mental health crisis that we've all, really become aware of, I think the conversation is really happening, and it's a very big opportunity, I think, now for our community and through Cassie and Friends and Brain Canada and that initiative to really help improve mental health care and resources for our patients.
I think you brought up something so interesting, which was what with the families with younger children. And I know there's lots of parents likely listening in today. And I wonder if you would just talk a little bit about, because I think parents of the younger children, so say the 2-year-old who has completely put their foot down when it comes to their Friday methotrexate shot. And this is like, in essence, crippling the family, basically. They it sounds like anxiety, but I think, is it often seen as a mental health issue or like just a problem to overcome? And how do you pull that apart in clinic?
So very common, unfortunately, scenario that you're speaking of. And I think it has been challenging in the younger age groups, because I think most of the, let's say, mental health screening tools that we might use in clinical care and practice, they're geared towards adolescents, and they've been tested in adolescents. When it comes to the younger age groups, it's a little bit more, I would say, murkier waters. Not that there aren't things available to help evaluate and assess, but that younger age group, it can be challenging for, I think, clinicians like rheumatology clinicians to feel comfortable thinking about things like depression, anxiety, and other types of mental health disorders. I would say that, we're relatively inexperienced in this realm. I think we really benefit from the expertise from psychologists in this realm, because I think they really have much more of a longer standing expertise in how to deal with specific issues, let's say medication related, or maybe more generalized issues, generalized anxiety, which I think can coexist together, unfortunately. I will say that, in our juvenile myositis population, we recently took part in a multi-center study for mental health screening that was actually based in the United States, but we were really happy to be a Canadian site. And what we found, looking at the younger age groups down to age 5 with juvenile myositis, maybe expectedly because the parents told us that it wasn't going to be an issue, but maybe unexpectedly from a, traditional rheumatology clinician lens, we found that there was a lot of mental health issues going on, even in that younger population, particularly related to anxiety and particularly related to injections such as methotrexate. So I think that was really eye-opening and important to really document, really as a first step to, okay, let's see, now that we've documented the problem, how can we better identify it going forward, and then also develop interventions and care practices that help address the problem. And, Kayla, to speak to what you said, not as an add-on, like, oh, and by the way, how are you doing, but more integrated into the actual rheumatology care, so that, things are invited to be brought up as issues really early in the conversation, so it doesn't feel like it's an added-on piece.
Thank you. I know you did some really important work working with clinicians and researchers across the US, as well as representing Canada, to set an agenda for what mental health research needs to happen in pediatric rheumatology. And I wonder if you would just share a little bit about what made that prioritized agenda and what was identified as needed for more research.
Sure. So the agenda, really came out of wanting a roadmap for, how do we tackle this, seemingly huge issue of mental health in a more systematic way that we can say, okay, here are the areas that need more knowledge and how can we prioritize that. So, what was really nice is we were able to bring together a multidisciplinary group of folks. So not just the rheumatologists, but also psychologists, psychiatrists, social workers. I'm sure there were more people in there. And then we always value patient and caregiver input as well, to really set forth, the areas. And the major areas that came out were, what is the burden of mental health problems in our pediatric rheumatology patients, but also for, caregivers and siblings as important, family members. And then thinking about, like, what is the relationship of the mental health issues to the actual disease? Because I think that we need to think about these together, that it's not just, there's a depression or there's an anxiety, but really thinking about it in the context of the specific rheumatologic disease is really important to capture those nuances and think about tailoring interventions and care. And then moving forward, thinking more about interventions, we had 5 sort of major areas. So the first 2 I talked about, but the other 3 are more thinking about what do we do? So how do we improve mental health education for patients and families and for providers as well? How do we improve identification through mental health screening? And then also, how do we improve mental health intervention for patients in particular, but also, again, thinking about the caregivers and the siblings, what can be done to really aid that. So with those 5 areas, everything was thought to be important, really. But, what rose to the top was trying to understand the burden. So things like how common are mental health problems, which ones are the most frequent, and then also understanding who is at most risk for developing mental health problems. And then the second area that rose to the top for the priorities was trying to understand that relationship between the mental health and the disease. But we also asked about feasibility of, what's the easiest thing, sort of what can we do today to help, improve mental health care and research. And what came to the top there was the mental health screening. Let's work on identifying people who are having, who are struggling, who are having mental health challenges. And so, that's what we really started focusing on. And, it's really great to say that, studies like, Dr. Stringer's and other studies, this, juvenile myositis screening project have really gotten off the ground, yielding some results. And there's even starting to be some implementation of mental health screening practices into clinical care, which is really great to see.
I love that. And I love that spirit of of everyone working on it together, because it is a new topic and a sort of a new thing to wade into. And I mean, the conversation about mental health, just like as a society whole, and we've been all getting more comfortable talking about it. But I love that feeling of, it's not just like for the patients to speak up, but also like, as clinicians, how can we better talk about it or put it as a part of our care and work with the patients and families, to all do better together. And I think that that's a really exciting path forward, when it's not just one problem on one side or a specific group, but like just in general, that we all need to raise our level of mental health awareness, and, just putting the kids first, really, and wanting them to have, the best opportunities and feelings and potential, and really just their little best lives. And I think that sounds like it's really getting into that work in that space. Dr. Danguecan, I wanted to talk to you a little bit, because I know that some of your research did look into a possible intervention, or like, what can we do? What's something we could try that might help in this space? And did you want to share a little bit about that? And I believe it was in specifically the childhood lupus population.
Exactly. I was really quite privileged to act as an interventionist for a multi-site study looking at a 6-session cognitive behavioral therapy intervention for youth with lupus. And specifically for this intervention, we were looking to target symptoms of pain, low mood, and fatigue as well, which are really commonly experienced in youth with lupus, as well as other rheumatic diseases. And something that I think a lot of our youth really appreciated is that this intervention was remotely delivered over Zoom. So it allowed us to reach out and provide increased access to patients who find it really difficult to come into the hospital for a weekly intervention. I think the youth really appreciated the flexibility of scheduling, as well as the opportunity to work things around their busy schedules with school and with other appointments that they had, as well as after school activities that they should absolutely be involved in. So something that we really worked on as part of that intervention are a lot of really great self-management tools, such as improving sleep routine, how to maximize treatment adherence, communicate with caregivers about their mental health, try to reframe thoughts about negative emotions and difficulties with coping, and really trying to harness strength from some of those inner conversations that can be quite negative. So it was really quite an honor to be hearing the stories of the youth I was working with, and trying to understand how the rheumatic condition impacts their everyday life, and how we can work with them to really promote positive coping strategies, and also working with them on some level of acceptance of, these are symptoms that come with rheumatic conditions such as lupus, but it doesn't have to mean that your life stops, or that you can't do some of the things that your friends do, but that there are ways to help you manage. There are ways that we can help you communicate with your family and your friends about your condition. And there are ways that you can also connect with your rheumatology medical team as well.
Amazing. Kayla, I'm so interested to hear how that resonates with you, because I know you're a marine biologist, you're working at an ad company this summer, you're a synchronized swimmer, and I mean, clearly you have a huge life in and around and outside of having juvenile arthritis. And what does, hearing about that study and the way it was sort of developed and offered, like, to fit into that whole life picture, like, does that resonate with you? Is that something that you've experienced in terms of trying to juggle all of these priorities?
Yeah. It's so good to hear that there was a big focus, especially around the figuring out how to communicate with your siblings or friends and stuff, because that really is something, I did kind of mention that, it's such a struggle just explaining what you have to other people. And I think even my parents didn't know how to tell people what was going on. I didn't know how to say what was going on. And I think that starting that young is so so helpful, because I think it's like been what 2 or 3 years since I've even felt comfortable telling people what I have and telling them like, oh, it's fine if you ask questions. Like I find not the best at explaining it. So I always end with, if you have any questions, feel free to ask me. And I think that like telling people that that's fine to do is so good, especially right off the bat with the kind of research and work that you guys are all doing.
Incredible. Dr. Stringer, I just kind of based on where all the conversation is going and thinking about sort of the use of like self-report questionnaires as one of the tools, like what do you think are sort of the benefits and limitations from both the clinical side and the patient side of a tool like a self-report questionnaire?
Yeah, I think mostly I would say benefits. I think you have to find the right questionnaire for your population. And I guess that's where I'll look to some of the experts in terms of, you'd want it to be like short, but you'd want it to pick up on the things that you need to find. I think adding a routine screening questionnaire just normalizes, the thing you're asking about, which I think is important because we ask about how many sore joints you have each time someone comes in. But if we just ask those questions each time, I think it just makes it part of the conversation. And I think the only downside, and it's not really a downside, it's more just of a challenge and a problem, is that if you identify all these people, these young people are having issues, but you don't have the adequate support for them on the other side, that could be, is a problem. So, sometimes I think you ask someone about these things and then you don't actually have any way to help them. And I see this, and like what Dr. Knight was saying, I am aware of, resources within my clinic, but if you serve a very sort of geographically wide area and rural areas and places that don't have even family doctors, where do you send, or how do you get these people to access the support they need? And that's sort of like a really awful feeling when you know that there's a problem, but you don't have the ability to help them like you would like to. So I think if we're screening, which I do think we should do, we have to have the support on the other side. And that, I guess, would be the sort of thing we need to figure out and solve.
Yes, absolutely. And Dr. Knight, we chatted a little bit before about a recent journal article that came out that you were one of the co-authors that was called "The Elephant in the Room," cleverly spelled RHEUM. But time to address mental health is a priority in pediatric rheumatology care. And we have from Dr. Stringer, we have some hard data on pretty concerning prevalence from many, many amazing youth like Kayla who have stepped up in the community to really honestly and vulnerably share their story and say this is a problem. Let's take the elephant and make it very visual through our personal stories. And the incredible research being done by Dr. Danguecan that's trying intervention, trying things and getting feedback. And so how in your call that it is time to really make this a priority, how do we begin? Where do we begin to bring all those pieces together?
Yeah, so I think that the first thing is really having conversations like this and having conversations in the community, but even more, formally, I think that, with the Cassie and Friends, and I'll just sort of jump to this, the mental health working group that is forming, I think that's going to be really important because what it represents to me is formal engagement of, again, that whole multidisciplinary group, including patients and caregivers, to really come together and define what are the goals for improving mental health care for our young people with rheumatologic disease in Canada. And then also defining, where are we right now? Like, what is happening across Canada in terms of mental health resources and supports that are available? I don't think that we quite have that information. I think we each in our own silos know what's available and what's not. And usually it's the fact that there's not as much availability as we need. But I think we really need to band together and present that data even more widely and broadly and starkly to say, this is what it's like for mental health resources and supports for our patients and families here in Canada. And then I think as part of that plan going forward, then we have a basis off which to say, okay, this is what we need, getting back to those goals. These are the types of projects, whether they're anchored in clinical care, such as something called quality improvement for improving care, or whether they're anchored in research studies. This is what we need to do, not just at one site, because I think, we've been doing things at one site, which is great, but we need to expand to multi-sites, multiple centers saying, this is what we're going to do to improve care now. This is what we're going to do to study this and improve our knowledge now. And then moving forward from there, thinking about improving things in a more broad fashion. And so this is what I really am excited about with the mental health working group, because, as we've been discussing, the mental health resources, they're not adequate enough. And we don't want to get into a situation, as Dr. Stringer is saying, where we identify all this need clinically, and then we don't have any plan of what to do. And so I think we need to do these things in tandem with each other.
Amazing. I think we'll just end by just going around quickly. And Kayla, what piece of that plan or coming together do you think youth can take control of or contribute in?
Well, I feel like we can't be a huge help on the getting actual people to work, like they were just saying. But I do think just the awareness factor and just talking to other people, telling people, like, people need to know that it's an issue for anything to even happen. So I think that is something that we can help with for sure.
That's excellent. And like you have helped us as Cassie and Friends do a better job of giving youth a real, like, meaningful platform of space to either just connect with others, because that is like helpful and amazing to have in your life, is to know someone else who's dealing with some of the same struggles, but also to, like, share your story in a way that feels comfortable, or participating in research or working groups, etc. We have a transition working group where some amazing youth are really helping to talk about, like, what it was like to make the jump from pediatric to adult care, and where they felt that was really challenging and could have been done better. So thank you, and thank you for all you've done, Kayla. Dr. Stringer, I'm going to ask you to speak a little bit from the clinician side, but also from, like, what you feel like parents also can do, whether it be in that clinic room or afterwards in being a part of a community like Cassie and Friends, to help us, solve the issues that are ahead in mental health.
So I think as a clinician in Canada, I think I'm very excited about the working groups, initiatives, in that we have a really great history of working together in Canada in research. And I think that will all be very helpful in terms of moving this ahead. And I think everyone will be very enthusiastic about participating and, getting at that lay of the land and working together. And in terms of, because the study that I did, it really sort of came out of my interest in transition, to be honest, and so I really focused on an adolescent age group. I think it's for parents, it's challenging. And, I'm a parent myself, and, it's, there has to be, I guess, dialogue between themselves and the teen, but I think that that can be really difficult sometimes. So perhaps, that's where some of the, focus should be. And Andrea was saying how, we have to include the families, because if they're not comfortable talking about it, then, their teen is not going to be comfortable talking to them about it. And then, they may discuss it with the clinician, but, it's not sort of being discussed as a family. So I think, maybe parents who are really interested in this area could almost act as, mentors for other parents in terms of how they speak to their children about mental health in the context of having a rheumatic disease.
Yeah, that's an excellent, a really great suggestion. And thank you so much for participating today. Dr. Danguecan, what about scientists and researchers? What role are you going to play?
I think that's a great question. I think that researchers such as myself, Dr. Knight, and Dr. Stringer have a huge role to play in terms of advocating for the types of programs, interventions, services that would be really helpful across rheumatology clinics. I think some of the things that we've discussed in this session can be really powerful tools, such as providing evidence for routine mental health screening, and how that can be a really powerful avenue through which to identify mental health concerns, but also to normalize conversations around mental health care within rheumatology clinics, and in the context of the rheumatologist being viewed as the primary health provider for so many of our young people with rheumatic diseases. I think to providing hard evidence and evidence of patients being really receptive to interventions such as the remotely delivered intervention that I spoke about for youth with lupus, but really understanding how that can positively impact overall well-being as well as disease outcomes for these patients, I think can really help to advocate for implementing these programs in more widely and more broadly across rheumatology clinics as well, and really providing the services that are needed to support overall well-being, but also disease outcomes for these patients. And I think that what is really great is that there is this increased movement in research in general to engage patients and caregivers in the research process. And I hope that those listening can really consider participating in research studies, as well as offering their input on how they're receiving that research and how they might be able to participate in other ways to support all of this work going into improving the mental health of patients with rheumatic disease.
Thank you. And I think it's so exciting to have experts like yourself who are both involved in pediatric rheumatology and other areas to bring your expertise to this area. And I think, collaboration or working together both in pediatric rheumatology and with experts in adolescent medicine and mental health and all those other areas has really been highlighted in this conversation. And from the Cassie and Friends perspective, we just, our strategy is just to keep talking about it really openly and having, whether it be webinars on it or a mental health resource section on our website, where you can not only find resources for your kids or your teens, but also for yourself as a caregiver. Because as I think Dr. Stringer mentioned, like your mental health as a parent or caregiver is so important too. And just keep bringing together our community, because the last thing anyone should do is have to navigate these kind of mental health issues alone. And that's what we've really focused on at Cassie and Friends, is that there is no alone in pediatric rheumatology, that we are a really big and vibrant and amazing community, that the more we can connect, the stronger we'll become to help each other together. So I just want to thank you guys all very much again for being a part of this Ask the Expert conversation today. And I'm really excited about the work ahead and also like the joy ahead in, sharing like where we've had successes and, being together and where we're hitting roadblocks and challenges. And I think that always that combination of families and youth working really hand in hand with their clinic teams and every member of those clinic teams, from physicians through the nurses. They're such an amazing resource, social workers, physiotherapists, occupational therapists, the whole team. And then the science community, or the scientific community that's, putting together the really important research that ultimately will allow us some real numbers and data to call together as a community for more resources for pediatric rheumatology, which is the ultimate sort of goal and outcome that we hope to see, that we can equalize mental health care supports across pediatric rheumatology clinics in Canada, and can equalize access between those that live close to a hospital center and those that live very, very far from their rheumatology care center in Canada. And that's, not even delving into the amazing sort of diversity across Canada and making sure we're meeting people where they are. So thank you so much for being a part of that work. And we're really, really honored to work with everyone, including yourselves, to move forward from here. So thank you. And that will be a wrap today on Ask the Expert. Please do visit cassieandfriends.ca if you are looking for resources and mental health, and feel really confident and excited to also bring up your interest in clinic, because I think that will make a big difference in the end. Thank you, guys.
Thank you. Thank you.